Hi, this is Brian Wormers. I'm one of the faculty at the University of Sioux Falls, and I'm going to be reviewing the course syllabus for NUR 431 Nursing Capstone. This is a 3-credit course. You get one for all the work that you're doing as part of a didactic, and then 2 parts of this is for your clinicals. So a presentation is going to be online and then mostly clinical. So course description: the focus of this course is to provide clinical opportunities for the student to grow in professional nursing knowledge and skills, in addition to the expansion of the clinical role. The course will focus on assessment and preparation for NCLEX. So this is meant to showcase all of your skills that you've learned so far and aggregate and put everything together. So credit hours, this is a diverse modality course, so you're going to have some clinical and then you're going to have some online components to this as well. Learning objectives. So at the end of this, you will see that you've got all these learning objectives for this course. So as you're looking for nursing expected student outcomes, they are right here. You'll have 8 of those, and you will have to do a write-up on those. But if you think about this, this is all just a nice summation of all the things that you've done so far and putting it all together, and that's really what the capstone is for. Required resources, so your APA book, which you've already got, or you should have already, and then any previous resources and references, so drug guides, ATI references, those kind of things. And then you should have the ANA books here, and these will help you write to the scope and standards of practice for a nurse. In this course, we'll have lots of different things for you to do and that you'll be evaluated on. So of course, a big part of this is clinical, and so you need to be communicating to your clinical instructor in a very timely manner, and you need to be talking about this with your clinical faculty or your capstone faculty on a weekly basis. This should be in the form of posting online in the LMS, just in the comment sections, and it's just like a paragraph about what are you doing this week, what have you learning, and just kind of touching base that way. And then, of course, you need to complete all of your clinical hours. You need 90 clinical hours. You need a satisfactory eval by your preceptor. And then, before you start any of that, you need to have your CASA branch up to date. Do not let this wax and wane over a break here. Make sure you stay on top of that and that you're ready to go by January. Capstone assignments, we'll cover this in more detail in that soft chalk orientation. But some things to look forward to are that you get to do a synthesis paper on the role of professional nurse, especially in the area that you've been assigned to. You will do a poster presentation on like a case study for one of your patients that you've had, and then you'll have a capstone final summary paper, and that was one of those that you will have your 8 expected student outcomes, as well as what did you learn during this experience. So after the month of January, we will get into more NCLEX prep, and we'll do this extensively. You will have weekly ATI capstone content. You will have some dynamic quizzes. You're going to have a comprehensive practice exams, A and B, as well as remediation for those. And then you'll be doing a big comprehensive predictor with remediation. So there will be an NCLEX live review late in this semester. Right after you graduate, or right before you graduate, I should say. And then, of course, at the end, you'll meet with your faculty advisor, and we will develop a plan with you and make a calendar of the things that you need to study and ways that you can be ready for NCLEX. Last little portion of this will be clinical reflections, and that will be kind of a write-up about the things that you did for clinicals. And then you'll have a student eval of capstone and what you thought of all this. So traditional grading scale for our nursing, and so you can see that all here. You need to have a B- in this class to advance within nursing. Expansion of evaluation. So like I said, there are other videos that will tell you about these kind of things, but you can see this here. You need to keep your clinical faculty and your capstone USF faculty up to date and up to speed about the shifts that you have. And that's part of this communication. Setting up a capstone calendar that we will send out to you. And then you've got to, let us know of any changes with this one. Your faculty have to be aware. Of course, the ones in the hospital need to know about this because you have to work with them. But also the faculty here at USF need to know about this because whenever you're on call or you're working, we're on call in case there's any sort of issues or anything we need to help out with. Weekly communication, so this is on LMS. This is not texting. This is not calling. This is not just swinging by the office. This is formally in the LMS for each week. It's not meant to be super big, but just an update as to what's going on. What are you doing now? What are you achieving? What are you doing? So it's kind of an update. Completion of all clinical hours. I mean, that goes without saying. You need to have 90 clinical hours with this. You'll be working with your preceptor in the month of January. And then you have to work a shift to its entirety. You can't just bail at lunchtime or halfway through the thing, or you can't just hit your 90 total hours and say, okay, see ya. Finish off that shift. It's a more professional way to do this, and we don't want to hear about anybody leaving early because they hit their 90. Satisfactory eval by your preceptor. I mean, this is just what it sounds like. We'll send an eval form to your preceptor, and they will grade you, and they will keep you up to date on how you're doing with that. And at the end, you just need to pass from them. Clinical reflections, we talked about that. This is going to be after each shift. You're going to upload these reflections in groups of 4. So shifts 1 through 4 will be in one section, and shifts 5 through 8 will be in another one. And if you have more, then that will be after that. But this is all will be on the LMS as a Dropbox. Just keep one running document and just keep adding to it and uploading it. You have a synthesis paper, and more of this will be discussed in a different video. But you're going to be putting together all the things that you've learned so far. And it's a nice summation of what you've done. Clinical experience poster presentation. So this is about it's a case study, and basically you're presenting on a case study. There's more details on different videos that you'll be able to watch, but we will talk about this. Use that One Button Studio to record this and upload this, but then also be aware that you will present this on campus. Capstone final summary. So as it says, this is a final summary paper. There's more videos about this, but you've also got a rubric that you can go off of with these. Weekly ATI Capstone content. That will be starting. You will have some dynamic quizzes that you get to do. You will have a love-hate relationship with NCLEX and the ATIs that go with it. But we do this to get you ready to take your NCLEX, take it once, pass, and move on. So that's your live review that you'll have close to graduation. And then ATI Comprehensive Predictor. So we'll do this and see where you're at and see how ready you are for NCLEX. So once you do all this, once you meet satisfactory, so you need to have some clearance to take NCLEX. So you have to have this kind of percentages on your ATI Comprehensive Predictor to pass your capstone course. Once you pass your capstone course, then you can go on, you'll graduate USF, and you can take your NCLEX. If that doesn't happen, you need to do this remediation and these kind of things. And that way you can be cleared to take NCLEX. Student evaluation of Capstone, we talked about that briefly before, but just we're gathering feedback for this course, and we just want to hear about what you thought of it. So here's your course schedule of when things are due. So like I said, clinical experiences are in January. Clinical reflections, upload those. Your first upload should be on January 20th. Your second one should be on February 3rd. You'll have ATI dynamic quizzes that you have to do. You'll have comprehensive predictors, and these dates are already set for you. You'll have your synthesis paper that's due on January 23rd. You'll have a poster presentation due on February 20th. You'll have a capstone final summary paper due on February 20th. And then you've got all these ATI things here for you too. So, on every syllabus we do put policy and procedures, so you can read about academic honesty, compliance with ADA, and then copyright infractions. And of course, if you have any questions on this, please come talk to us. We're happy to answer those questions. So that should give you a nice overview of the course, and then just watch other videos for more specifics about some of those assignments. If you have questions, please come talk to us. All right, thank you.